All right, I see folks joining. Several folks will probably jump in along the way. Thank you guys, everyone who's already joined and who is in the process of joining for our evening together tonight to talk about COVID-19 needs in the autism community. This is a very exciting thing for us because we have been working very hard at Autism Speaks on our COVID-19 response, and we'd love to be able to share that with you. Tonight's agenda, we're going to do a little bit of a welcome and introduction, and then we'll have some key presentations by Autism Speaks staff. We have 3 staff tonight that will be presenting to you. And then we'll have plenty of time, 25 or 30 minutes at the end for audience Q&A. So as we go along, please make note of or enter your questions, and we'll be excited to be able to engage with you and answer your questions along the way. So I know many people are joining tonight. We're really excited. We have several hundred people that have signed up for this. So thank you very much. Welcome. We are going to just do a little bit of housekeeping first. We have a recording. In fact, the entire recording of this will be available on YouTube tomorrow. So if you're not able to catch everything, you can catch it on YouTube. We also have, for folks that need communication support, there's closed captioning available. So if you want to click on the CC icon in your Zoom window to turn on automatic closed captioning, you should be able to access it there. And we'll be using the Q&A feature, as I mentioned tonight, so that you can submit your questions to our panelists. And after hearing from our panelists, we'll ask them to respond to your questions for the last half of our time together. If you have a question that is specific to your needs or situation, we do have help available from our autism response team. They can answer your questions and follow up with resources if you need them. You'll see a lot of information here, and we will follow up with an email to all of our registered attendees with a full report and slides. So our panelists, as I said, I'm the moderator. My name is Dr. Thomas Frazier. I'm the Chief Science Officer at Autism Speaks. I'm also the father of a 17-year-old son with autism. We have Lindsay Nader, who's our Senior Director for Mission Delivery. Vijay Vasudevan, who is our Associate Data Scientist. And Angela Lello, who is our Senior Director for Public Policy. So we're excited for them to join us tonight. I don't need to tell this group, I'm sure everyone on here knows, it's been quite a challenging year. The pandemic has brought really widespread disruption for all of us, but especially for children and adults with autism and families with autism. It's been a really rapidly changing situation over time. We've tried to respond very early on in the pandemic. We tried to respond as quickly as possible, but our response has really been in 3 phases. Early on, we were just trying to manage some of the disruptions and engage in whatever public health measures we could to try to alleviate some of the concerns in the community. And then that really evolved as the pandemic started to, unfortunately, drag on. It started to evolve into, we recognized we needed to understand the needs of the community and we needed to respond to those needs. And then as we went on, we were able to start collecting data and conducting our own research and really analyzing the needs and everything that we were hearing from the community. We started to really dig into that data and figure out what it is that we need to do. And so we're now sharing this knowledge via our COVID-19 report. And our speakers tonight, the 3 individuals I just mentioned, are going to be sharing that in much more detail. So you can see on this slide is a copy of our special report on COVID-19 and autism, and you're going to hear a lot more about that in the next few minutes. So first up in our series of talks tonight is going to be Lindsay Nader. Lindsay's going to be talking to us about our work to understand and respond to COVID-19 needs in the autism community. Lindsay, take it away.
Great, thanks so much, Tom. Again, we really don't need to state this, but these have been such unprecedented times for really everyone. But the reason we're here tonight is to really talk about how COVID really created some major challenges specifically impacting the autism community. And almost beginning immediately, right in March of 2020, we started to see a significant increase in our calls to our autism response team for help, for support, for making sense of what was going on. Right away, we started hearing about challenges related to continuing services with schools, programs closing, disruptions in routines, day-to-day, usual life was completely turned upside down, services being delayed or in some cases stopped completely, and struggles with transitioning to telehealth. For some communities, that was completely unheard of. Others were not really comfortable. But either way, stopping in-person visits became quite a challenge to adapt to relatively quickly. Next, we were hearing from parents and caregivers that over the course of weeks, as Tom said, you know, the early phases, we were sort of adjusting and preparing for maybe 1 or 2 weeks of this new normal. But suddenly it started to settle in that this was going to be here for quite a while. So parents and caregivers needed to adjust to now the new role of being an at-home teacher, service provider, their child's therapist, and in many cases also trying to manage all of those new hats while working their own job. Others started to report loss of employment, which led to major financial crisis within the home, not only with just paying for day-to-day life, but also with funding for needed autism services and continuation of some of those interventions. We started to hear about needs for caring for the caregiver and the stress and the anxiety that everyone taking on these new roles was feeling. And then we started to see contacts directly from adults with autism who were struggling, being cut off from services, being cut off from friends and family and loved ones and support systems that they've built up through their community engagement. And also started to face the loss of internships and employment opportunities and jobs. And in some cases, you know, colleges and universities shutting down took away a lot of those connections as well. So we started to hear from autistic people saying they were experiencing increased anxiety and depression as well. So all in all, we knew we had to act fast. Autism Speaks started to see these calls and these emails and these chats go up, and we needed to do something, and we knew we needed to do something really fast. So we turned to researching autism-specific COVID resources. Next slide, please. And what we saw was over half of the urgent requests that we were receiving were for financial assistance specifically. And you can see why that you know, can be overarching, right? Because it's hard to separate all of the other types of autism-related support requests if you can't fund your basic needs. So with over 50% of those needs coming in, we also started to see challenges with accessing behavioral resources. Another top request was educational and IEP help. In some cases, all school supports stopped and parents were expected to just keep going without any supports. Family support request was also another top need just in terms of coping with all of these changes. And really, just like anything in the autism community, no two needs were the same, no two requests were exactly the same because everyone has been affected so differently during this pandemic. So right from the beginning, our team started to research as many resources as possible. This was not going to be a cookie cutter approach, and 5 or 6 resources was not going to cut it for our community. And we started to find things that were state specific. We started to find resources and created videos and teaching stories to be able to help parents and autistic people adapt to some of the new restrictions and regulations around wearing masks or social distancing. And we knew we also needed to make these resources widely available. So the autism response team was here to help if folks reached out and needed specific personalized support, but we also built a COVID resource web portal where we started with about 30 to 40 resources by the end of March. And then fast forward into the summer, we had hundreds up on the web portal. Next slide, please. Through all of this, our autism response team really has been on the front lines. So we're monitoring all of the opportunities to support our community, but we're also keeping track of all of the data that we received. And we're going to talk more a little bit about the scientific approach there, but anecdotally, we heard from over hundreds and hundreds of families that were having similar experiences, but really what we saw was there was always something unique to that individual that, you know, required them to develop a person-centered plan, to develop some type of support system that was specific to their needs. And the autism response team was able to support 2,700 individual contacts through the pandemic so far. We've also responded to the major financial resource request by providing 752 Autism Speaks Cares grants, a great start to get people through a crisis. But in many cases, we also had to work pretty closely with them to find even more sources of local funding and emergency relief within the community. And we've also grown that database that I mentioned to now have over 900 COVID-specific resources and tools. And we will continue to grow those resources as we continue to navigate through this difficult time. Next slide, please. Another really important part of our COVID response and support has been to pivot really quickly, or as quickly as possible, to virtual programming, right? So everyone had to learn about Zoom. Everyone had to learn about telehealth, and we needed to be a part of that transition. And we've learned some things, and there have been some silver lining, and we're definitely not ever going to take away what we have learned. The pandemic has taught us that making all of our resources available virtually is a great way to include members of our community that otherwise would not have access. Right away, we started to communicate at the community level. We knew that, you know, you turn on your TV and you see some national trends and you see all of the scary stuff around, you know, the COVID surges. But really what matters to you is what's going on in your specific community. What does it mean when you need to go to the grocery store in your community? If you don't have childcare and you have to bring your autistic child with you, how do you work with them to wear a mask when you're going out, right? So we started to deliver webinars and virtual programming at the state level. So it made sense to our constituents who are living in those communities, in those zip codes. And as regulations begin to change and evolve, as we're still seeing today, we're also adapting all of our resources to make sure that we have videos, visual tools, teaching stories that stay up to date, right? So mask mandates, mask wearing, social distancing, it's all changing, it's all evolving based on, you know, the science that's out there and what's going on. And we have to stay current. And we are making sure that we have a local source of information when individuals are reaching out to us. Next slide, please. Now, this is a really important one. It is my last slide for this evening, but we want everyone to walk away knowing that if you still are in need of assistance, or you know someone who is struggling and needs autism tools, information, or resources, it has been a long road so far, and we know there's much more recovery needed. We want you to walk away with our autism response team contact information so you know where you can go for assistance. Again, Art is here this evening to answer questions, but you may want more personalized assistance, so please feel free to call. We have an English line and a Spanish line. You can send an email to us tonight, and in the morning we'll get to a response. And you can also go to autismspeaks.org and live chat with one of our associates. Thank you guys so much for listening tonight, and remember, we're here to help.
Thanks, Lindsay. That was really great. And, you know, thank you for everything that you and your team have done, and really the whole services and supports group, and that you're continuing to do, I should say. Next up is Vijay Vasudevan, and Vijay is going to talk to us about measuring community needs and learning about the health impacts of COVID-19.
Thanks, Tom. So I'll briefly go over each of these points on this slide here as we go through them in my slides. Next slide, please. So why did we even do this? Why do we even want to know more about this information? So a lot of the previous research that had been done had looked at individuals with intellectual and developmental disabilities, and had not specifically for individuals in households where people with autism. And we know that our community has needs that just needs to be measured and understood. And the findings that we learned from this informs our organization and helps us prioritize what resources to find and create to support the community, and helps us understand what better to advocate for in public policy. And it was such as like the previous other needs assessments looked only at healthcare issues. And as Lindsay says, that in the autism response team, when they heard that so there were many other areas of need, such as school and work, that were really important for people in our community. Next slide. So building on this, we went into our first needs assessment in May, where we really wanted to look at a broad understanding of how the pandemic was affecting households of people with autism, and such as affecting their housing, food access, healthcare, education, and employment. And we did this by conducting a needs assessment in 10 states, which were highly populated and had high rates of COVID infection. And we sent it out to using our autism response team, advocacy efforts, and services and support teams. Half of our respondents were Black and minority, and half were white. Next slide, please. And what we found was that many of our constituents were struggling with many of these issues. They were struggling with health and safety, such as how to wear a mask, how to socially distance, learning supports, housing insecurity, being physically active, mental health issues, and food insecurity, where over 70% of all of our respondents were saying that they were worried that food would run out before they had money to buy more. And this is especially true for minority households. And this really led us into needing to understand more in our follow-up survey. And which was done in December 2020. And this really we really wanted to know a better understanding of how the pandemic was impacting food insecurity for households of people with autism. And because the pandemic had spread nationally by this stage, we wanted to survey all 50 states and District of Columbia. And luckily, we were able to hear back from 1,500 constituent households from 48 states and DC, where over 60% of the families said that they were white, 15% were Black, and 15% were Hispanic. And over half said that they lived in suburban communities, 30% said that they lived in an urban community, while the remaining said that they lived in a rural community. What was really helpful was we used the survey items that came from national public health surveys, but we really tailored them for our autistic families and made sure that they were really specific for them. Next slide, please. And so what the bottom line of what came out of these surveys was that food insecurity really increased across the board as the pandemic wore on. And this really impacted people with autism as they struggled to find food. And this could be struggling to find food regardless of what they were looking for, or maybe specifically trying to find food specific to them, like food specificity issues or food specific to their medical conditions or their chronic comorbidity issues as well. And this was even more so for minority households who had someone with autism in their community as well, or in their household as well, where they were especially hard hit with food insecurity. Next slide. Where over almost 75% of Hispanic households with someone with autism in the household experienced food insecurity during the pandemic from our respondents. And nearly 2/3 of Black non-Hispanic households experienced food insecurity if they had someone with autism during the pandemic, compared with a white household with someone with autism, where only about 44% experienced food insecurity. Next slide, please. And this slide shows that if you lived in an urban or a rural community, you were more likely to experience food insecurity compared to someone who lived in a suburban community. And this is really going to impact your ability to access food. Next slide. And this next slide discusses food insecurity by support level. And this is really important to us at Autism Speaks because we want to address everyone across the spectrum and support people across the spectrum. And what this shows is that people who have increased support needs are also more likely to experience an increased likelihood of food insecurity. Next slide. And this final study that we were doing was to really try and understand the prevalence and impact of COVID-19 with specific regards to hospitalization and length of stay in a hospital. And the hospitalization is an important indicator of severe disease. And it's important because many times as someone with households with someone with autism might experience increased likelihood of missed work or expenditure related to costs with autism as well. There's increased healthcare expenditures and services. And what we really want to understand is how it relates to COVID. And given the time frame of the study that we're experiencing the first and second surges of COVID, so we really want to understand this. Next slide, please. So why did we even want to explore this? A lot of the other available research around this study population explored people living in congregate settings or people with intellectual disabilities, or the studies were looking only at the state level Medicaid data, which is not really allowable for consistent reporting across state lines. And specific for people with autism and COVID, it's really important to explore this. And this type of information is really important with regards to public health decisions, which can really protect our community, such as vaccine prioritization recommendations. And this is really important, as we'll explain in a minute. Next slide, please. So what did we find? And these three pieces of related information really tell the health impacts of COVID for households of people with autism in ways that other findings haven't been able to. Even though people with autism have a lower prevalence of COVID-19 infections compared to people with other health conditions, they had a substantially higher risk of hospitalization when they did get a COVID-19 infection. And a greater percentage of people with autism, regardless of if they had it alone or with another intellectual or developmental disability, they had a greater likelihood of dying from COVID-19. Next slide, please. And this has led these next two slides. So like when you can control for other factors like race and age, people with autism are almost 9 times more likely to die from COVID-19 compared to someone without any other chronic conditions. This slide shows that having COVID-19 is very expensive, and it's an economic burden for households and their day-to-day decisions about money for healthcare, services, and food and housing, especially for policymakers to understand the trend regarding exploring how this relates to Medicaid and how policymakers decide about Medicaid and how it's funded. So what have we done about this? As Lindsay said, that we've trained and taught families how to wear PPEs and be socially distant, connect the families to resources and programs. And then we're specifically regarding to our studies, all our data is going to peer review scientific journals so that they can be used by policymakers for informing their decisions. And I'm just going to end there given our time.
Thank you, VJ. Really appreciate that. It's very cool to see the work that you've done, the survey, the research that you've done, and how it really directly leads to some actions that we can take to make things better for individuals and families. Thanks. And speaking of action, I'm going to pass it off now to Angela Lello, who is going to talk about our advocacy for the autism community during COVID-19.
Thanks, Tom. And thanks everyone for joining us tonight. You know, Autism Speaks as an advocacy organization identifies our advocacy priorities early on, and we start working on those at the federal level here in Washington, D.C., as well as out in state houses across the country. And so just like everyone else, 2020 started off as a typical year for our advocacy department. We were really focused on our priorities, and then the pandemic hit. And it shut down Congress as well as the rest of the world. And when Congress stopped operating on its normal agenda, a lot of attention started being focused on the response to coronavirus and what federal policymakers were going to do about it. And thanks to the work from our response team and our science team, we were really informed in the advocacy department about the top priorities for our community. And so we quickly identified 4 things that we wanted to work on and that we wanted to get included in legislation that was getting passed by Congress. Telehealth, we knew that people were getting disruptions to healthcare and services. Lindsay told us all about how people were missing out on needed therapies. And so we knew we needed to do something about telehealth. Secondly, we needed to help home and community-based services, which provide funding for day programs and respite and family caregiver support. And we also needed to protect special education and make sure Individuals with Disabilities Education Act programs resumed as soon as possible and safely as possible. And then finally, we needed to make sure that our community had access to those individual economic stimulus payments that helped people weather this financial storm. So that's what we decided to focus on, but how we decided to focus on it is really important because our advocacy relies on the strength of our volunteers and our advocates. This year, we had almost 3 times as much community participation as we did last year. We have a Hill Day in Washington, D.C. every year. And this year, we had 3 times as many Hill meetings as we did in 2019. In 2020, when everything was shut down, of course, nobody was coming to D.C. But this year, we were able to have a virtual forum. And we had members of our community from all across the country who were plugged into our advocacy work help and tell their stories to members of Congress, to senators, and we really were effective. We were able to get a lot of our priorities. We were able to get a 10% increase funding for home and community-based services. We were able to get dedicated IDEA funding. And as of today, we have almost 70 members of Congress supporting our appropriations requests for autism investments from the federal government. And we expect more to come in over the next 2 weeks. So a big thanks goes out to our volunteer advocates and all of our community members who are helping to drive our advocacy. Next slide, please. So the American Rescue Plan was the bill that was passed just a few weeks ago. And not only did it address all of our COVID advocacy priorities, but it included over $2.6 billion, billion with a B, for home and community-based services, which are the critical safety net our community relies on. But wait, there's much more. So our priorities. First, we really focused hard on expanding telehealth services and other flexibilities for autism services. This was sort of universally understood as very important to not just our community, but every community that had people with disabilities, other individuals with chronic health conditions that had to get their health care. Increasing funding for home and community-based services not only helps adults with autism, but it also helps children with autism in these programs, and it helps the family caregivers. Educational supports for students with autism were one of the biggest unmet needs in our community. And we were also concerned that there was going to be a waiver of these critical protections. And finally, those economic impact payments help address some of the food insecurity and other financial insecurities that our community was facing in dire times when this pandemic first started. Unfortunately, telehealth was addressed in the Consolidated Appropriations Act. Increased funding for HCBS and IDEA, as well as the economic impact payments, were all included in the American Rescue Plan. Next slide, please. So with regards to telehealth, we were able to get additional telehealth flexibilities retained through the end of the year Consolidated Appropriations Act. So what this did and why this matters is it created funding specifically for a telehealth program for healthcare providers. This included over $250 million, plus an additional $140 million for telehealth and broadband efforts in tribal communities. This is important because if your healthcare provider can't connect to the internet or doesn't have the technology to provide telehealth, then you're going to go without services. So these funds were very important to help build that infrastructure that our healthcare system relied on. And in a lot of cases, these services also shored up rural hospitals that will have a ripple effect on communities that rely on the same large providers and systems for care. Next slide, please. So we got a little bit of extra money for home and community-based services. It was quite a historic amount. Originally in 2020, we were supporting early on individual separate bills that would help improve the infrastructure of this critical safety net. We were optimistic that early legislation would include funding. But by the time the end of 2020 rolled around, we still hadn't secured dedicated funding for this system. So we tried very hard. Our advocates were very strong. And at the end of the day, we were able to increase the amount of dedicated funding from 7.3% to 10% federal funds, which resulted in over $12.6 billion for Medicaid HCBS. And, you know, this is a safety net system that support so many different individuals across our country and across the spectrum that without these services, there's no telling what different situations people were in. And so it's very important to help provide the system with a little additional flexibility so that our people can get their services and their needs met. Next slide, please. So Lindsay talked a little bit about some of the education needs that we were hearing about. Well, we were very focused on making sure that the Individuals with Disabilities Education Act maintained its strength throughout the COVID-19 response. There were some waivers of federal education law that were being considered. And fortunately, we were able to maintain IDEA protections, but also we started supporting standalone legislation that would dedicate funding for special education to provide schools with the resources they need to provide recovery services and to help students with disabilities address some of those unmet needs that they had been missing over the last year plus. So early on, we were very successful. And again, we were not able to get this additional funding until at the very last minute as a result of all of our advocates talking to their members and telling their stories. At the end of the day, the American Rescue Plan included $3 billion in dedicated special education funding. Next slide, please. So, you know, you heard a lot about the financial insecurity that this pandemic has brought to our community. Early on, individual stimulus or economic impact payments were enacted by Congress, but unfortunately it excluded adult dependents. So disabled adult children of parents who still claimed them on their taxes were not able to get access to the stimulus checks, and those parents didn't get any additional resources for those disabled adult dependents. We worked very hard to make sure that this rule was changed, and we were quite pleased that starting March 12th, the IRS began issuing stimulus checks to individuals, including adult dependents. And this round was $1,400 stimulus checks. And this is so important to help address some of the individual income and financial insecurity. But we know it's just a little bit of support, and we hope that it does address some of these needs that we were seeing. Next slide, please. So, although there was a lot of successes in the American Rescue Plan, and we were very pleased to see all 4 of our top priorities get enacted, we still have much work to do in our advocacy. We have to make sure we flow all of these funds for HCBS providers and schools directly to where they're needed. We need to make sure that states are using these funds for their intended purposes and that they're getting to our community at the end of the day. And there's still some questions about how disabled adults are going to receive their stimulus and whether or not everyone is going to get their checks now or in the future. And we need to keep monitoring telehealth and making sure it's accessible for everyone in our community, and we address any gaps that arise. But we know that Congress and the White House are continuing to propose additional legislation. You might have heard about the American Jobs Plan, which is a $2.68 trillion proposal from the White House and President Biden that would do a number of things to address infrastructure, but it would also include over $400 billion for Medicaid, home and community-based services. The details on what that proposal actually entails are still yet to be determined. And so there's a lot of questions and unknown about what that proposal actually will contain. And also there hasn't been legislation introduced. Right now it's just a proposal, but Congress is the one that's going to be passing the laws. And we as advocates will continue to engage with Congress and rely on our grassroots and our volunteer advocates to help make sure our voice is heard. And beyond that, we'll probably see another American Families Plan and even more legislation to continue addressing coronavirus. But with your help, we can continue to advance our priorities and make sure that the autism community is front and center when these debates occur. Thank you.
Thanks, Angela. And, great work and obviously more work to come, but really thank you and the whole advocacy team for all of the hard work you've done here to bring about these changes that we know are going to be really useful and important for our community. And thanks also to VJ and Lindsay for your presentations. It's really good to get this info out there. And I think, obviously our community needs to know what's happening, what we're doing, and the kinds of changes that are coming down the road. I do want to remind everyone, just please continue to submit your questions to our panelists. If you have a question that is specific to your needs or situation, we do have help available from our autism response team. They can answer questions and follow up with resources if you need them. So don't hesitate to jump in. We're joined by some additional folks here from our science team. We have Dr. Andy Shearer, who's our Vice President of Public Health and Inclusion. We also have from our advocacy team, Stuart Spielman, our Senior Vice President of Advocacy, Kelly Hedrick, who is our Senior Director of State Government Affairs, and Dave Sikowski, who's our Senior Director for Policy and Government Affairs. And also, I think we are going to have Val Parodies from our Services and Supports team as well. Val is our Vice President of Services and Supports. So I think we've got a first question here. This is probably for you, Lindsay, but maybe Stuart. The question is, children are still struggling with mask wearing, but they're required at school. Is this something that can be an accommodation in public or in school?
I can kick that one off and then pass it to my colleagues on the advocacy side to, sort of provide that perspective. But a lot of times what we're hearing from families, especially when faced with the opportunity of going back to school, is all or nothing, right? So it has to be, an immediate, if your child can't do this, then they can't come. If they can do this, then they can come. And really, that's why we have a lot of legal protections within our IEP process. So we would say that is definitely a goal that you need to work towards with whether it's your child's team, behavioral supports, at home and consistently in whatever setting they'll be moving into, going back to in-person education. But it's not a quick fix, and the school should be responsible and is responsible for getting that child the supports they need to be able to work up to wearing that mask to be able to follow that policy. That's definitely something, if you're speaking from experience and asking that question, that the autism response team can work with you on. We have some of those resources, including videos and social stories and teaching stories that may help you begin that conversation. And also that you can share with your educators and your child's team if they also need some additional supports on building a plan and working towards that goal. And I'll stop there and let the advocacy folks talk about the legal side of that.
So I'm going to invite my colleagues to join in here. But I recall that some of the original mask requirements did contain exceptions or provide for accommodations. Now, it has been the experience that sometimes policies don't translate well from top to bottom, from officials to the ground. But I think what Lindsay's guidance, that you try to work with the people who are in your immediate community as a first resort, is spot on. That's what you try to do. There are possible ways of approaching this if no accommodations are made, but I think that's the first start I think the art team may be helpful in specific situations where there may not be any accommodations made, but I'll invite my other advocacy team colleagues to add if they choose.
No, I think you really all summed it up well. These are local decisions made, as a part of your interactions also with these schools. The Department of Education has put out kind of broad guidance to schools, the Federal Department of Education, regarding reopening, and they do talk about students with disabilities who have difficulties with masks, and speak to the fact that schools should be working with the families to be able to address that, and be able to have strategies there. But again, it goes back to kind of that connection locally at your own school and trying to work with them.
Great, thanks, guys. Our next question is actually a couple of questions that are highly related here. This person noted that there's a lot of money for COVID relief in education, and they're wondering sort of how are states going to be accountable in spending it for people with disabilities? What do we expect it to get spent on? And who's gonna be accountable to that? Who's gonna decide where this money is going? So I know there's a lot of different mechanisms here. Maybe we can just pick off one or two and talk about it.
Yeah, sure. So I'll start, and Dave and Stuart can jump in. So essentially there's funding that will go directly to the school districts. There is funding that your governor will receive and can spend as they see fit on education recovery. And then there is funding that is going specifically to special education, or IDEA, that will flow down to schools the same way IDEA funds currently flow. At the end of the day, the Department of Ed and the federal government, the Federal Department of Education, is the agency that oversees and ensures that those funds are spent according to law. They will collect information from state education agencies, which will collect information from the local school districts or the local education agencies. The governor also will oversee and report on their spending from the governor's funds. Congress, including the committees of jurisdiction, so the Senate Health, Education, Labor and Pensions Committee, and the House Education and Labor Committee, also have oversight, and they have expressed an interest in hearing more from the department about how these funds are spent. At the local level, your individual school district will be making decisions about how they use their recovery funds, essentially. So advocates who are concerned or interested in the use of these funds should stay connected with us, but also with their local school district, their school board. Also stay tuned to the state education agency and your governor's office to learn more about what they're saying. Dave, did you have anything to add on that?
No, I mean, I think that was great. I mean, we're going to do what we can in terms of our advocacy to try to, ensure there's some accountability around this, and ensuring that some of this money is flowing to students in the on the autism spectrum and with other disabilities. And so, as Angela said, stay in touch with us, but also there are definitely ways to advocate as well at the local level.
And I'll just add, this is Kelly. I will put in the chat, if you're not signed up to receive advocacy alerts and would be interested in that, if we are working on something in your state, whether it has to do with special education, insurance coverage, Medicaid, other things, we often will send out an alert as well as posting something on our advocacy social media channels. And we encourage everyone, your stories are really valuable. Your voice as constituents are really valuable. So please consider signing up if you're not already receiving those. Thanks.
All right. The next question, I'll start off, and then Andy, maybe you can join in. The question is, why are people with autism more likely to be hospitalized from COVID? The honest answer here is we don't know exactly why. Unfortunately, the data that we've collected don't dig into the exact reasons for why we're seeing this pretty significant increase in hospitalizations, but we do have some hints from our knowledge of autism and what happens with autism. So we know, for example, that many people with autism have co-occurring medical or mental health conditions. And in particular, some of the medical conditions that co-occur in autism are conditions that would increase risk for hospitalization for COVID. For example, there's a subset of individuals with autism that have immunologic related difficulties or metabolic related difficulties. And those would, at least in some cases, increase risk for hospitalization from COVID. There's also a subset of children with autism that have cardiovascular difficulties. And we know that cardiovascular risks are associated with increased morbidity or difficulties from COVID-19 infection. So those are sort of initial hints. Andy, I don't know if you want to add anything to that.
No, I think you captured all the key elements, Tom.
Great.
Tom, the CDC also says that children with obesity, diabetes, asthma, and chronic lung disease are also maybe at increased risk for COVID too.
Right. Yeah. So as part of the comorbidities, there is an increase in some of those factors in our population as well. Right. Great point, VJ. Okay. Next question. This is another one for science. Are the COVID vaccines safe? Where can we find reliable information? There's a lot of misinformation online. Well, anyone who's at all associated with autism knows that there's a lot of misinformation online. So I'm not sure a truer statement's ever been written, but the COVID-19 vaccines are safe. The CDC has been putting out a lot of really good communication around this. So you can go to the CDC website. We're not, there are no medical professionals on this call, but we always encourage people that if you have concerns, please talk to your physician. All of the data out there from the CDC suggests that the two vaccines that are being widely distributed right now, the Pfizer and the Moderna vaccines, are very safe. The Johnson & Johnson vaccine that has been taken down temporarily, there was a very rare side effect that seemed to be affecting younger to middle-aged women with a particular type of profile. And I don't know more about it to be able to speak intelligently on it, but that was a very, very specific situation. that was not related to autism. Andy and the public health team, I don't know if you want to add to that.
I think you know, what you said is absolutely true, and our understanding is that the government continued to monitor these adverse reactions, so, for example, the clotting disorder that Tom mentioned is really you know, you can count them on two hands out of millions of vaccinations, right? So it is a very, very rare event, but so far we have not heard anything about adverse event associated with individuals or family affected by autism.
Thanks, Andy. The next question has two parts. The first one is for advocacy, and then Lindsay, maybe you can jump in on the second part. So now we're in the vaccine phase. What is being done or can be done to help people with autism who are still not able to access the vaccine? So we'll start with the first part there for advocacy.
So that's a great question. And what we are trying to do at Autism Speaks, and what we've tried to do since vaccines first became available, was emphasize to our partners, particularly agencies like the Centers for Disease Control and Prevention, the importance of protecting people with autism. Tom and my other colleagues on the science team have discussed some of the comorbidities, and we've brought that up. So we will continue to inform our colleagues about specific risk factors and concerns, and the work we've been doing at Autism Speaks. I will also add that next week, the Office of Autism Research Coordination is going to be holding an event which is open to the entire autism community. It's going to be another Zoom meeting, and one of the participants in the event is the director of the National Center for Birth Defects and Developmental Disabilities at the Centers for Disease Control. So that may be another opportunity to gain some insights on what is doing and what can be done to protect individuals in the autism community.
I'll just jump in. Thank goodness for all my colleagues on the line that are working for big solutions to increase accessibility here. But on an individual level, if you or your family or someone you know is having trouble with accessing anything, you know, from healthcare related to COVID, vaccine sites, anything that you feel autism is providing an extra obstacle or layer that's creating difficulties for you, please reach out to the Autism Response Team. You can think of us as your personal accommodation to help you find information locally. We'll start with all of the resources that Stuart just mentioned, but then we can, you know, think creatively as well. Maybe we'll contact some local service providers that have had success, and we could put you in contact with some of those folks who may be able to help you with those accessibility issues. So again, 888-AUTISM-2, email help@autismspeaks.org, or chat with us at autismspeaks.org.
And Lindsay, there's a second part there just about what can be done to make the experience easier or accessible. Is there anything we want to add to that?
Absolutely. So, you know, if you're in our community, and you are, if you're on this webinar, you know that preparation, you know, and taking away as much anxiety of the unknown is a key part of that. So you can reach out to the Autism Response Team as well. We'd be glad to connect you with social stories and other visual supports that will help you start the conversation about what to expect, you know, through that experience, and also share resources with, you know, schools and other professionals as well, to be able to support those conversations, to remove as much of the unexpected anxiety as we can.
But I'll just mention another thing, and this is not always possible, but when my son went to get his first shot, he waited a very long time, which is quite difficult for him, as it is for many of us, whether you have autism or not. But for the second shot, my wife actually just said, "Hey, why not? I'll just try and call ahead." And she called ahead and spoke to somebody, and we got there, and this person was very kind and generous and got us through very quickly this second time through. So, you know, it doesn't hurt to try to grease the wheels and be nice to people either. So the next question is back to science. I'm hoping the public health team will jump in here. So do you know if vaccines have been approved for children ages 12 to 15 years old yet? Is there anything we can do to prepare our child for that vaccine experience? Well, we've kind of talked, Lindsay just kind of talked about the experience, but in terms of the approval, where are we at, guys, with broad accessibility there for 12 to 15?
Thanks, Tom. Our understanding is that those studies are ongoing, and some are, I think, have already closed, finished data collection. We should be hearing some outcomes in the next month or so about children under 16.
Great. All right. Next question. Sorry, my computer froze for a second. What are the priorities for 2021 in your conversations with policymakers? So obviously this one will go to the advocacy team.
I'm gonna toss this over to some of my colleagues to join in. I think David and Angela can address federal priorities, and Kelly can talk about state priorities.
Sure. I can touch briefly on the federal funding piece for research, and then I'm going to turn it over to Angela to talk about some of the work on home and community-based services and other areas. So one of our biggest priorities is trying to increase the federal investment in autism research. There's this great federal advisory committee that Stuart referenced, the Interagency Autism Coordinating Committee, which brings together the autism community in terms of representatives from every federal agency, autistic adults, family members, researchers, advocacy organizations, et cetera. And so they put out recommendations every so often about the strategic direction of research and looking at recommendations for federal funding. And so what we've been working on is trying to get Congress to provide funding that is kind of commensurate with those strategic objectives and those funding recommendations. We've come a long way in terms of autism research. There's been a lot of money that has been invested. And what that's revealed is kind of a need for more investment, in the sense that we know now more about comorbid health conditions that people on the autism spectrum have. But what are we doing in terms of the personalized interventions to be able to assist folks in terms of anxiety or depression or other health issues? Looking at other types of early intervention, diagnosis, providing services. There's a huge dearth in research related to services, particularly for autistic adults and the transition to adulthood. There are so many areas of funding where there needs to be a boost. And so we're in the midst of this right now, actually, in terms of trying to influence Congress to do more. As Angela referenced earlier in her presentation, we already have nearly 70 members of Congress who have signed on to a letter in the House of Representatives. We're going to keep building those numbers up to try to build that further. But let me turn it over to Angela to talk a little bit about home and community-based services in terms of some of the additional work that we're doing there, both with Congress, but also trying to influence the administration. And Angela, also feel free to talk about any other areas of advocacy that you want to.
Well, I think, really what I'll talk about is our efforts to advance policies that help people across the lifespan access services that they need, right? So what are lifespan services? They are in part Medicaid, home and community-based services. And so we are working with Congress on the development of legislation that would fund and help address the services cliff that individuals fall off when they turn 21, right? And so what do those services look like? How do states provide them? And we're working on legislation that would do that, but also we've been focusing on building the infrastructure of this safety net system, where in some cases it's very frayed. It varies widely across and within states. So if you take the same child with autism or the same adult with autism and you move states, you will get vastly different services. The quality will be different. And in some cases, you might not get any services at all. So we're really focused on addressing those gaps and those critical needs, while at the same time looking forward and thinking about what do we need to do to end to bridge the services cliff so that folks don't just fall off into the abyss when they enter adulthood, and also support family caregivers so that when they do have children, they're able to support them transition to a fulfilling adulthood. And at the same time, we're working with the administration, so federal Medicaid agency, to make sure they're implementing this program in a way that meets all of the needs in our community and isn't done in a way that inadvertently takes things away or maybe causes more harm than good. And at the same time, we're also looking at employment. So there has been a number of discussions or, different committees in both the Senate and the House have announced intention to revisit America's workforce policies. Well, what do those look like? These are the policies that the government enacts to try and get Americans to work. And so we are trying to make sure that those policies are inclusive and they target our community as a critically underserved community when it comes to workforce policy. So help create workforce systems of the future that are targeting adults with autism and making sure they get jobs. And so I will kick it over to Kelly, who can talk about some of what we're doing at the state level.
All right, thanks, Angela. I'll just say very quickly, since I know we're over time, that at the state level, a lot of our time is spent because the insurance and Medicaid, a lot of the details and regulations there are done at the state level. And we're still trying to make sure that there aren't gaps within Medicaid, within private insurance for those services that are on the healthcare side versus like the home and community-based services side, the behavioral therapies, the other mental health services, the occupational and physical therapy. So we have a number of initiatives underway in states across the country to try to close those gaps to make sure everybody with autism who needs those healthcare services is able to receive them without big barriers. And I'll stop there. Thanks.
Well, thank you, Kelly, and thank you, Angela. I just want to end by saying, thanks to everyone who participated. They were great questions. I don't need to tell this group what a tough year it's been, but we do hope that this webinar was able to get you the information that you need. And I hope also that you see that we are continuing to work hard at Autism Speaks to address the needs of the autism community. Let's all hope over the next few months that we can move to a much better place in the pandemic. And please don't hesitate to reach out to our autism response team if you need something. Thanks a lot, everybody, and let's have a great night.